Good afternoon, and I'm joined today by Director Stephen Williams and Dr. David Pearce, the Medical Director for the City of Houston. In 2 days, Texas will lift the requirement to wear masks and reopen businesses 100%. I want to thank the Houston area restaurants and businesses that are planning a responsible transition and making health and safety for their customers, employees, and the general public a priority. Many of those businesses are going to continue requiring people to wear masks and keep their current occupancy rates or require social distancing. Employees and visitors will be required to continue wearing a mask in a city-owned facility. There's been a lot of conversation over, let's say, businesses planning these mask-off parties, but I want to provide some good news. And I received an email today from the owner and operator of Concrete Cowboy, and I want to read the email that he sent to me. Said, Mayor Turner, first and foremost, I'd like to thank you for taking the time to read this email. Mayor Turner, it was never our intention to host a party where we encourage patrons to not wear a mask. I am a business owner of multiple venues in the Washington corridor, and public safety is our top concern, and we will always place health and safety ahead of profits. That being said, we are not only canceling the party, but we will also not open Concrete Cowboy Wednesday night to prevent any exposure to COVID-19. I do want to reassure you that all 4 of my businesses on Washington Avenue will also continue to follow that same policy of safety first. I hope that in the future we can work together. You know, you can trust me to always put the public first and to work together with you and your office. Thank you for your time. Dan Wyatt, owner and operator. And let me thank Dan and Concrete Cowboy for recognizing the importance of what we're trying to do. And look, we want businesses to open. We want businesses to thrive in our city. And quite frankly, I do believe that 2 months from now, the landscape will be much better than what it is today. I do believe that it's too early now to just take off the mask. It's one thing for the businesses to be all the way open, but I do want people to encourage people to wear their masks. I want businesses to encourage people to wear their masks, their customers, their patrons. And I want to thank Concrete Cowboy for the steps that they are taking that I believe is in the best interest of the health and safety of Houstonians. And I want to thank all of the owners. I know, look, these last 12 months have been hard. They've been hard on our medical professionals, our essential workers, our businesses, small, medium, and large, on homeowners, families, our children. It's been hard. But I do see a glimmer of hope. I do see the end of this tunnel. I think many of us can see the end of this tunnel. That's why the 2 individuals that are standing with me today, Director Williams of our Public Health Department and Dr. Pearce, are here as we try to do everything we can to ramp up getting these shots in people's arms. So again, let me thank Concrete Cowboy for taking the initiative, stepping up, and canceling that mask-off party. This is not the time to drop our masks or drop our guard in the fight against the pandemic. People are still getting infected and individuals are still dying because of the virus. Today, the city of Houston's positivity rate is 13.1%, which is up from last week. So instead of going down, it's kind of creeping right back up. We're also reporting 318 new cases of COVID-19, bringing the total case count for the city of Houston to 175,150. There are also, unfortunately, 6 new people who have died, bringing Houston's total number of deaths to 2018. As you know, over the weekend, we crossed that, unfortunately, that 2,000 mark in the city of Houston. We continue to make progress getting people vaccinated, getting shots into arms, but we are nowhere near obtaining herd immunity yet. And before I go into any specific numbers, I'm going let me just yield to Director Williams, and then followed by Dr. Peirce, and then I'll come back a little bit later. Director Williams.
Thank you, Mayor. Today, in partnership with United Memorial Methodist Center, the Houston Health Department will open a new drive-through vaccination site at the parking spot near George Bush Intercontinental Airport. We're actually going to use that site as a second dose site. The other drive-through site at Del Mar Stadium, we will continue as a drive-through site. It's going to be our site for first doses. Our Bayou Event Center will continue to be a fixed site, serving about 1,000 individuals a day, operating Monday through Saturday. We will continue operating our health centers and our multi-service centers as vaccination sites for both first doses and second doses. Our access and equity strategy continues by providing trusted community clinics, such as pharmacies and other venues, such as this weekend we were at the Mexican consulate. We have also been at clinics such as Setagaz Health Clinic, Gulfgate Health Center, Ibacina Clinic, Hope Clinic, the MLK Center, El Franco Center, partnering with Kroger's and Walgreens also. We anticipate in the future that we'll be able to deploy mobile sites that will get more specifically in communities. As vaccine becomes more available, we will also increase the number of sites. We will continue to target those that are most vulnerable. One interesting note is that 93% of those individuals in Texas who died of COVID are over 50 years and older, and so therefore that would be a priority population for us. All sites are appointment only. You can join our wait list at houstonemergency.org. Our wait list registration is also available by phone to people aged 60 and older through the Area Agency on Aging, 832-393-4301. People with disabilities can call the Aging and Disability Resource Center at 832-393-5500. Anyone else needing registration assistance can contact the COVID-19 call center at 832-393-4220. And that's not only a call center for appointments, but generally the general public actually calls that number to answer general COVID questions.
Thank you, Mayor. Director Williams. Mayor, as you know, we've been testing the wastewater because we know that fecal material will carry the virus. Right? Anyone who's infected, regardless of how sick they are, will excrete a virus in their feces. And so we've been testing for that. We began that in May of last year, making Houston the first city in the nation to be doing so. In February, just last month, we developed the ability to be able to sequence the viruses found in the wastewater and look for particular variants. And so we've identified that the UK variant, the B117, is found in our city's wastewater. And for February the 8th, it was found in 22 of the, let me make sure I got my numbers right here. Yeah, it was found in, on February the 8th, it was found in 21 of the city's 39 wastewater treatment plants. And on the 22nd, it was found in 31 of the city's 39 treatment plants. And this map that you have in front of you, the yellow areas are wastewater treatment plant drainage areas for which we have not found any variant. For the for the dark purple, for the light purple was the one that was initially found and is now spread into the dark purple. And so in the end, what we found is that 19% of all the virus that has been tested in the wastewater across the city has the genome that's consistent with the UK variant. Now, that does not mean that 19% of the people in Houston are infected with the UK variant. It does not mean that, because people will, as we know, people who are ill are going to have more, tend to have more diarrhea, therefore will contribute more, so you cannot make that connection. But what we do know is that there is a fairly large amount of the UK variant in our community, and it is spreading. The other question I expect people to have is, what about the other variants? And so we have developed the ability to test for those as well, and we have in fact found the other variants, Brazilian and the South African in particular. However, the measurements of that are not, those calculations are not done yet, so I don't have that to report. But the bottom line is that, again, you know, we were concerned about people dropping their guard and not wearing the masks and gathering in ways that we wish that they wouldn't. Remember, the UK variant is the one which spreads much more easily, and we're seeing that with the South African and the Brazilian as well. They spread much more easily. So we're not there yet. Those viruses are in the community. And so, as we've said before, to some degree, the race is on. The race is on to get as many people vaccinated as possible before the UK variant is able to take over and cause us to have another surge. Mayor?
Let me just say before we take questions, if you have them, this virus is just proven to be very persistent, and it's not easy to just totally crush. And so when given the opportunity to spread, it takes advantage of that opportunity. And as you can see, the positivity rate was going down over the last couple of weeks, and then now this week it has creeped up slightly. So it's just important for us all to continue to do what we know we need to do, and that is, at the very minimum, you know, please keep your mask on. That protects you from me and me from you. So let me just encourage you to do that. As things open up, let's say as of Wednesday going forward, it's just in everybody's best interest to do that. And then secondly, let me encourage people to get tested. A lot of conversation about getting the shot in the arm, but at the same time, that doesn't diminish the importance of getting tested. So please take advantage of getting tested. You won't have any problems. You can pretty much go to any of these free testing sites, and there's not much of a wait at all. So please get tested, especially if you haven't been vaccinated. Get tested. The other thing is, do take advantage of the different vaccination locations. Please either go online or please call, especially like the Area Agency on Aging. Get on the waiting list. There are more vaccines that are being made available every single week. And, of course, our goal is to try to get these shots in the arms as quickly as possible. And then lastly, with all of the variants that are within the city of Houston, you know, that just points to the added importance of being tested and getting vaccinated. So please do that. And again, I want to thank all of our businesses who have have just dealt with some terrific challenges over the last 12 months. I want to thank our businesses, small, medium-sized, and large. I want to thank all of the homeowners and patrons, and you name it. And then working together, we will come through all of this. Having said that, we stand ready to take any questions that you all may have.
Mayor, with the state mandate being lifted, are you concerned about a fourth wave of COVID?
We are, and not just myself, but people in the medical community, our doctors and other medical professionals are concerned about a fourth surge. You know, we saw what happened, for example, in end of April, when numbers were trending in the right direction and we opened up, and then we saw what happened in June, July, and August. And then again, we saw what took place. Numbers started trending in the right direction. Things opened up towards the end of October, and then we saw the numbers in November, December, and January. And so now with things being totally open as of Wednesday, 100%, and the rollback of the mass order, potentially we could face another surge. We don't want that to happen. And that's why, again, I do want to highlight and thank the concrete cement let me make sure I got Concrete Cowboy for the steps that they are taking, and others who are doing the same. People who may have been planning these masked off parties, who are changing their minds. I want to thank them. We can be critical of people when their actions are contrary to our wishes. We also should be able to applaud people when they're taking the necessary steps to keep everybody safe. So I want to thank all of our businesses who are working as we work our way through this crisis.
And again, what is your message to the public about wearing their mask?
Keep your mask on. And then in many cases, you see Director Williams, he has on too. The only reason I don't have on my second one is because I'm talking. But to keep your mask on. And let me yield to Dr. Purse, because he may want to add to the importance of that. You're hearing it from me, the mayor. Now, this is the chief medical officer for the city. So, Dr. Purse.
So, the CDC just recently came out with the guideline that recommended people consider wearing 2 masks. And we found that when the masks are worn, they actually did a pretty elaborate study showing that if both people are wearing 2 masks, the risk of transmission is almost 0. If one person is wearing a mask and another person is not wearing a mask, that mask does in fact help. So each mask helps, and the double layering helps even more. And so between now and when we're out of this, which, may be on the horizon, right? But between now and then, we need to all keep wearing our masks and prevent the transmission. Remember, most people who become infected, I shouldn't say most people, about 40% of the people who become infected have no symptoms. About 10% of the people who become infected wind up in the hospital. And about 10% of those folks wind up dying. So it is still serious. The virus is still here. This isn't over. Let's wear the mask. Let's protect ourselves. And also, my final thing is, remember, the person you are most likely to infect, and conversely, the person most likely to infect you, is actually a member of your own family. So protect your families. Wear the masks.
Doctor, before you step back, could you talk a little bit about spring break? It's coming up.
Yeah, so spring break is, we saw what happened in the late fall and through the holidays when people gathered in large groups and perhaps dropped their guard. And spring break is just another event like that. The difference perhaps being that spring break generally involves younger people in their 20s and 30s perhaps, college students going on spring break. Families with young folks will travel and gather. And quite honestly, the statistics are that most, but not all of those folks, if they become infected, will probably do well. The problem is they will then come back and then inadvertently spread it to others who may not do well. They may spread it to their neighbors, they may spread it to their grandparents, they may spread it to people who've got chronic illnesses. And so any activity that we engage in that gives the advantage, gives the upper hand to the virus is one we should avoid at this point. So for families who are planning on spring break activities, they need to have the coronavirus in mind as they make those plans. And please be smart and responsible as you make those plans. And for for the teenagers, the college students who are probably looking forward to having a typical spring break, I don't think maybe next year. This year is not the year for that, not yet.
Mayor, can we talk a little bit about the parks? The parks are opening. Will you enforce in any way wearing a mask while you're at the park? What are your expectations?
Yeah, the Parks Department of Parks and Rec, they've put out their protocols. We're trying to adhere to the CDC requirements. It is a phase-in opening. It's not all happening at one time. I've signed off on it. For example, as of today, is this March the 8th? As of today, for example, practices will be allowed for like Little League leagues, teams, for example. And then as we continue to look at our data, then I think right around March the 15th or so, 22nd, something like that, then games will start. And then towards the 29th, there'll be another group of activities that will be allowed, again, based on the numbers. So it is a gradual phase-in approach. Not everything, it's not 100%, but we're certainly saying to people, for example, if you're sitting in the stands watching your kids practice, to keep on your mask, things of that nature. With regards to city, other permitted events, permitted produce, We're still holding on a number of those things, parades, we're still holding on those things. So it's a gradual, phased-in approach, and we're just trying to be very methodical on how we reopen.
Okay, so in terms of the activities, will the kids be wearing masks while they're playing, like basketball, baseball, in the parks?
That I'll have to check with the Parks Rec to see what they are recommending on that. But they can certainly, I think a lot of these things should be online that people can see. But I don't know, yeah, it's online, so I'll have to double check myself, but it's a very phased-in approach.
Okay. And again, are you just asking the public to adhere to the policies, or will you be enforcing it in any way?
Well, I mean, for example, if you're coming to a city facility or city venue, you must have your mask on. I mean, that's clear. We've had one case where somebody came, I think, last week, and it may have been over to permitting, and they did not want to put their mask on, and they were escorted out. And so we are certainly encouraging and saying to everyone, city facilities, city venues, you must have your mask on.
Okay. I have a few questions unrelated to COVID. In terms of Dr. Latham leaving HISD, your thoughts?
Sad to see her go. She's been an exceptional person. She's been serving, for example, quote unquote, as an interim superintendent during some of the most challenging times in the history of our city and the history of any school district anywhere in the country. I think she's done an exceptional job. I hate to see her go. I wish she was staying. Okay? But her departure from here represents our loss. To the school district that has hired her, it's their gain. But she has been tested on so many different levels, from academic low performance and then getting things moving in the right direction, and then to coronavirus for 12 months, and then the winter storm. And she has just been steady in her management of the largest school district in the state of Texas. So if I had my preference, I would rather her to have stayed. But sometimes when you don't recognize what you have, people do have choices, and before you recognize it, somebody else recognizes the value, and now she's moving someplace else.
Anything to pass along to HISD in terms of them finding a new superintendent?
Well, you never miss your water till it's gone. Let me, what can I tell you when you add someone and another person has moved on? Let me just wish Superintendent Granitha Latham the very, very best. Let me say to the school board members and everybody else it is really all about the children and making sure that they get what they need, and leadership does matter. And so that's about all that I'll say on that front.
Okay, question about ERCOT. Why do you think the two bills you filed in 2011, 2015 regarding ERCOT did not pass?
Well, certainly I don't think the leadership recognized the severity of the importance of the problems back then. But back in 2011, the situation was similar to what took place a few weeks ago in the state of Texas. We were coming out of frigid freezing situations. A number of the power plants were offline, failed to function, and we did not have an adequate reserve in order to meet the demand. The bill that I filed back in 2011 required the PUC to mandate that ERCOT would maintain an adequate reserve to prevent blackouts. That is specifically what the bill said. There were the leadership and others in the legislature that did not see the need to do that, and so the bill was not given a hearing. And people did not, and people just assumed that the changes that were being made in 2011, designing a market-driven system where you allow the power generators, for example, to increase their charge when the demand exceeded the supply from a few thousand to $9,000 per megawatt. They thought that that would be enough to incentivize the power generators to weatherize their system. And that would be enough to have enough reserve power in order to meet the demand. They were wrong. Those assumptions were wrong. It hadn't happened over the last 10 years. And so but what I would say to you, all of what took place a few weeks ago was foreseeable and preventable. Hopefully this time, it just won't be a lot of talk and no action. Hopefully this time, as I've said before, there are dust that bill off and pass it in the legislature. But it needs to be not just a market-driven system. It needs to also be based on capacity. The system needs to be weatherized. We need to make sure that the costs are equally borne throughout all of the sectors and not just on the back of customers. And it certainly would be a good idea to utilize some of that rainy day fund and the dollars that will be coming from the stimulus package to help offset some of those costs.
Okay. Last question, Mayor. Clarification, when you spoke about the parks, you said obviously people watching the activities, you asking them to keep their face mask on?
If you understand, yes.
Yeah, and then you spoke about the young kids playing, and you said you're not sure if they're going to have their mask on?
That I'm not sure what the protocol is for that.
Okay. Thank you, Mayor.
Sure.